So today we'll be talking about examining a patient who comes into my office complaining of back and or leg pain. So the first thing we assess when looking at the patient is their overall balance. Here, we can see her alignment with her head above her pelvis. The next thing we look for is any sort of asymmetry or deformities. We check for the shoulders being level. We check for any pelvic obliquity. We check for any shift of her trunk. The next thing we will assess to see is if there's any tender points to palpation. So we'll palpate center on the lumbar spine, the thoracic and lumbar spine itself. Then we'll palpate in the paraspinal region, checking for any muscle tightness, muscle spasms, seeing if there's any pain present. The next thing we check for is range of motion. So we'll have the patient extend back, see what the range of motion is there, see if that elicits any pain. Next, with the leg straight, we'll have her bend forward. And occasionally, if people are having sciatic symptoms, their range of motion will be limited in both planes. The next thing we check for is lateral bending, and that loads the back joints of the spine. And then the last thing we check for is rotation and extension. And if somebody's having pain arising from the joints in the back of the spine, which are called the facet joints, then that can sometimes exacerbate the pain. The next part of the physical exam is testing for motor and sensation with the patient sitting. The nerves in the spine have three functions. They give sensation to the legs, numbness, tingling, burning. They give strength to the muscles, they innervate the muscles and give power to the muscles, which we're going to be testing for. And they also can be a source of pain for the patient. So we're going to be testing for these different aspects during this portion of the neurological exam. So with the patient sitting, the first thing we ask them is to lift their leg up as hard as they can here, good, and lift it up here. Then we have them kick this leg out towards us, good, and kick out here. And in this, we're testing to make sure that the strength is strong. We grade the strength and it's symmetric on both sides. Let me have you point your ankles up towards the ceiling, nice and strong, good. And keep the big toe pointed up, nice and strong. And push down like you're stepping on the gas, good, good. And the next portion is assessing for sensation. So we test the sensation to light touch. So we ask the patient, does this feel the same? Does it feel normal to them? And we test different aspects of the legs because the different parts of the legs correspond to different nerve roots in the spine. The next portion of the exam is assessing the reflexes. So there's two reflexes that we test for in the legs. So we ask that you relax the legs. We test for the patellar tendon reflex, which gives her a little knee jerk right here. And then the next one is for the Achilles reflex. And we test for some symmetry in the reflexes and that whether they're hyperactive, active, or absent. So the final portion of the physical exam is done with the patient lying supine on the table like this. Oftentimes, hip problems can be mistaken for back problems and or leg problems. So part of this examination is to see if there's any issue with the hips. So the first thing we check for to see if there's any flexion contracture of the hips. The next thing we do is we check for range of motion, specifically internal and external rotation of the hips, see if that elicits or reproduces any pain. The next test is what's called a Faber test, where we flex the hip up, we abduct the hip, and we externally rotate. And oftentimes, if patients are having sacroiliac joint pain that's reproducible, this will be positive. The final portion of the test is what's called the straight leg raise. So if a patient has an acute disc herniation that's pressing on a nerve, oftentimes this will cause pain running down into their leg. So with the straight leg raise, what we do is we flex the leg up like this, and often the patient will complain of pain running down the back or the side of their leg. That's the same pain that they came in complaining about. And if that test is positive, that may indicate that the patient does have an acute disc herniation.